Preventing mother-to-child transmission of HIV, also known as PMTCT, is vital in the fight against HIV and AIDS. In order for a pregnant woman who is HIV positive to avoid passing the virus on to her baby, she needs to have access to a variety of services. These services can include voluntary counseling and HIV testing, antiretroviral medication and to lower the risk of infection to the baby while in the womb, a cesarean birth, breastfeeding replacements, and continuing antiretroviral treatment to ensure that she stays alive and healthy in order to raise her child. There are many misconceptions about mother-to-child HIV transmission. Most major one being an HIV-positive mother will automatically infect her baby. This is actually not the case. Even without medical intervention, there's only a 15 to 45% chance that a mother will infect her baby. However, according to the Centers for Disease Control, with effective care and treatment, the likelihood of transmission to the baby can be reduced to less than 1%. Dr. Mitchell Besser is a medical doctor with a degree from Harvard Medical School. His specialty is in gynecology. He's dedicated his life to helping pregnant women who are living with HIV. In his TED Talk, Mothers Helping Mothers Fight HIV, he explains the work of his charity, Mothers to Mothers. Besser began Mothers to Mothers in 2009 in South Africa. Although it began in South Africa, it has since grown to include a variety of nations in sub-Saharan Africa. They include South Africa, Lesotho, Swaziland, Mozambique, Zambia, Malawi, Tanzania, Rwanda, Kenya, and Uganda. The program is based on the premise of mothers helping other mothers. They employ over 1,000 women who they call mentor mothers. The mentor mothers are HIV-positive women who have received PMTCT treatment and have given birth to HIV-negative children. They work with the women who enroll in the Mothers to Mothers program and help them through their treatment. They also perform some of the tasks that are normally done by nurses, except that the nurses don't have time to do them. The aim of the program is to provide support for the women who enroll in it, as well as account for the lack of available medical staff in sub-Saharan Africa and provide education about HIV transmission. One of the most important things about having the mentor mothers involved in the program is that their presence both reassures the women that the treatments that they are receiving can be successful and that they can then give birth to HIV-negative children, and that they also reduce the fear and stigma around HIV by talking about their experiences openly and honestly with their clients. The main theme of Dr. Besser's TED Talk is that in order to fix a problem, all elements of the solution must be successfully enabled. Dr. Besser structures his talk around a series of related topics, hooks that are connected by several intermediate introductions and conclusions to keep the audience interested. Since it is believed that the audience interest peaks around the introduction of a topic and wanes as the speaker continues on that same topic, frequent changes in focus in a presentation are recommended to keep the audience engaged. Each time Dr. Besser comes to the end of an intermediate topic, he concludes by slowing the cadence of his voice and summarizes that area of his talk in a few simple statements. This is either to catch up audience members who have drifted away during that section, or to cement his conclusion in the minds of his audience. He begins his talk with some general information. He uses statistics and graphics to illustrate the extent of the problem of mother-to-child transmission of HIV. He He explains the acronym PMTCT and debunks common misconceptions about the topic. He also gives background information on why the current healthcare system in sub-Saharan Africa is so broken and not working for mothers who are infected with HIV, despite advances in the effectiveness of HIV tests and antiretroviral drugs. By doing this, he's providing the necessary background information so the audience can understand the importance of his work and understand why he is doing what he is doing while audience attention is at its peak. Providing background information in this way is really effective because not only does it give the audience the impression that they will be learning something from the talk which really engages them, it also helps to show the talk's theme because it sets up the comparison between the old system, in which all aspects of the solution were not properly enabled, and compares it to Dr. Besser's new solution. He begins by introducing the medical side of the issue, because that is the one that is most commonly explored. He starts off by showing a graphic depicting the global HIV disease burden, and then a map of the world's doctors. He also shows a graphic that demonstrates the increased demand on nurses working in PMTCT clinics in sub-Saharan Africa by showing the increase in their duties between the years 2001 and 2010. He uses these graphics to show that despite advances in medical technology, the problem of HIV transition is not being properly addressed in Africa. Once he tackles the medical side of the problem, he explains the social and personal side of it. By shifting topics from stigma to financial enablement to education and outreach to involving men, he shows that stopping mother-to-child transmission of HIV is not just a medical issue, that it is just as much about breaking through social stigmas as it is about scientific breakthroughs. Dr. Besser concludes his talk by explaining how all these elements come together to make an impact on healthcare systems, communities, and mothers and babies in the fight against HIV by bringing all the topics that he's introduced together. He also puts forward a very heartening statistic. But by 2012, Mothers to Mothers had managed to reach out and enroll 20% of the global population of pregnant women living with HIV. Overall, I found Dr. Besser's TED Talk very easy to watch. The structure worked well and held my attention very easily. And was very easy to follow. One of my favorite things about the talk was how passionate Dr. Besser was. His belief in his cause was very obvious, and it made his talk very successful. The unfortunate reality is that HIV is still very stigmatized in much of the world, especially in many of the countries where Mothers to Mothers operates. Many people feel shame in revealing their true HIV status to their family members and friends because they fear being kicked out of their households. This poses a conflict between obtaining effective health care and balancing that with the expectations of society in which the women that Mothers to Mothers serve live. Many women face discrimination, violence, or even murder if they are revealed to be HIV positive. Women also face greater challenges in this area because in many places women are still blamed for spreading the virus. The greatest challenge Dr. Besser and others like him face in this field is that in order to keep these women and the society in general healthy, HIV status must be known and addressed in the areas where the virus is most prevalent. Unfortunately, acquiring and taking antiretroviral medication and using breastfeeding replacements make it almost impossible for women to keep their HIV status hidden. From a Canadian perspective, the government of British Columbia has enacted a very effective HIV treatment plan called 90-90-90, which has gained international attention. By 2020, the government aims to to ensure that 90% of HIV cases in the province are diagnosed, and then ensuring that 90% of patients have access to highly active antiretroviral medication, and then also ensuring that 90% of patients in the province are virally suppressed by 2020. In a recent article for the Times Colonist, BC Centre for Excellence HIV and AIDS Director Dr. Julio Montaner criticized the Canadian government for not taking a more aggressive stance in the fight against HIV transmission in Canada. Montaner criticized the Canadian government for allowing HIV treatment policy to vary widely across the country and not standardizing programs like 90-90-90, even though they're proven to be very effective. He also accuses government of ignoring the problem of HIV transmission, even though HIV has become an epidemic among Aboriginal communities, which is an area of the federal government's direct responsibility. He also accuses them of refusing to send a Canadian representative to the UN 1990 conference, which is He suggests that the failure of the government had to act on improving HIV treatment policy while acting very swiftly and effectively in the face of illnesses like SARS and Ebola shows the government's prejudice towards HIV victims and further stigmatizes the vulnerable populations from which they come. He says that the Canadian government has sent a message that they simply don't care about those living with HIV. In connection with my chosen TED Talk, this need for comprehensive understanding and care is what Dr. Besser focuses on when addressing the problem of stigma inhibiting people from getting the treatment that they need and that they deserve. He designed Mothers to Mothers and the Mentor Mother program to address this area of conflict and controversy of the stigma of HIV/AIDS in order to address the problem of mother-to-child HIV transmission more effectively. He says, the biggest barrier is stigma reduction. We have the medicines, we have the tests, but how do you reduce the stigma? This is the very essence of what both Dr. Besser's talk is about and what his life's work is about. HIV is not just a medical problem, it's just as much of a social problem. It is through this examination of the conflict and controversy of HIV stigma that Dr. Besser has been able to perfect an approach to dealing with TMDCT that addresses the problem from all angles, including the very controversial angle of stigma. In conclusion, the problem of mother-to-child HIV transmission can be effectively addressed if the problem is addressed from all the angles available, not just the medical ones. The stigma around HIV is pervasive and challenging to fight, but with enough education, community outreach, and support, the stigma can be reduced. The Mentor Mother program and Mothers to Mothers has been proven to be effective in both addressing medical concerns and reducing stigma. Dr. Besser said, "We have the medicines. All we have left to fight is the stigma." Thank you very much.